Hey everyone, today with us we have Dr. Ratnadeep Jadhav sir, who is the founder secretary of Indian Society of Digital Dentistry, and he has a clinical experience of more than 15 years. Welcome to our program, Adila sir.
Thank you so much.
So my first question is, was it always your choice to become a dentist?
Yes, it was always a choice to become a dentist, and actually, I got an admission in MBBS, and my family was not happy when I left MBBS and joined BDS. Those days, it was in 1992, and it was I believed my college and the atmosphere and the entire that atmosphere pulled me towards it, and I joined BDS.
That's very surprising to hear, sir, because most of the students take BDS because they couldn't secure an MBBS seat.
Actually, my mother was not very happy. She was not talking to me for 3 months when I took admission in BDS. But yes, because that time it was considered very, compared to MBBS.
Even nowadays, it's the same.
Yeah, yeah.
So, what made you develop passion towards BDS?
Yeah, over a period of time, initially I don't know, means I was not knowing what is there in dentistry and all. But overall, I think so. The atmosphere in the government dental college and the Mumbai atmosphere and overall, that entire college, pulled me in. That is one thing. And second, after going to the college, meeting with the seniors and the overall environment made me develop, and slowly I started liking the entire course and the college and curriculum and everything.
So, coming to my next question, what made you develop interest in implantology?
Yeah, it was in me since beginning that I wanted to learn newer things. Means you will not believe, in the initial days of my practice, I have traveled to Chennai just to attend one single lecture on aesthetic and cosmetic. So it was not about implantology all the time. It was initially aesthetic and cosmetic. So whatever new used to be there in dentistry, my focus was to go and get that technology in my clinic and help my patients having that kind of a treatment. So it was in 2006, 2005 I realized when I went to Germany for the IDS International Dental Show. There I saw that every alternate stall is all about implantology, and they are showing and showcasing different types of implants and surfaces. And then I realized that this is going to be the future. Like I have to be part of it. And then I started learning about implants, and then I did my first course, and then I did my masters in implantology.
So, where did you do your master's?
I did it from Goethe University, Germany.
So, you have been integrating CAD CAM and chairside dentistry. How has this affected your clinical practice?
See, first thing is that from implantology, my focus shifted on CAD CAM. Again, it was more of I got sold out to this technology when I went abroad and saw the entire workflow, and then I realized that if not me, then who? Then then I started attending few courses of scanning and integrated implantology, and then I realized that patient compliance is far better with this digital technology, and then it became my passion over a period of time.
So, do you think advancements in dental equipment make practice easy? If yes, what is the one recent equipment every clinic must possess?
I would rather say that dentistry has to be alive within you. You know, if it is died here, dead here, then whatever high, expensive gadgets you buy, it will not work. So if you are passionate about dentistry, then you will definitely pick up a lot of new things, lot of advanced things, and your intention has to be all the time helping your patients. It is not about any technology, any equipment. If you believe in that equipment, that this equipment is making my patient happy, making my treatments more and more accurate, precise, and it is helping my patients, then this technology works. Otherwise, just investing money, just putting money into gadgets and equipments and all, this is how you don't become a successful practitioner. This is what I believe. So the most important part is any technology or any equipment which is going to help and make my patients or make my treatments more and more better. Those equipments will definitely work.
So can you tell us a bit more about the upcoming Digital Dentistry Implantology Conclave?
So, this is a conclave organized by Indian Society of Digital Dentistry, and I am the founder secretary of this organization. And I have been into digital dentistry since last 6 to 7 years. And in my hospital, we practice this integrated implantology. We do aligners, we do smile designing, we do 3D printing. So I started believing in this technology, and I started feeling that this is the thing which is making my patients more and more happy and more satisfied. So we need to do something. So we few doctors, we came together and formed a society, and then our main intention and aim was to propagate and digital dentistry knowledge throughout the country in the clinicians. So we thought of organizing one congress wherein we can call experts in the various aspects of digital dentistry all over the globe to Pune, wherein dentists which can take this opportunity and come and attend this congress and get them, because to attend each and every course or each and every aspect in digital dentistry, you will have to travel all over the globe, meeting experts and all. So why not to bring them all together at one platform and make it available for all the clinicians in the country. So that was the aim. That's why we have organized this conclave.
It's such a good initiative, sir, because not only the clinicians are allowed to attend, but the students too, because most of the conferences only allow graduates.
Correct, correct. So, actually, those people who have this kind of an attitude to, look forward, look beyond what is being taught or what is there, and those all are invited basically. Means you need to have, there has to be a reciprocation. So we are seeing a lot of people who who understand and who get that kind of an feel that this is coming in a big way. Those people are understanding and coming and joining hands with us, and they are most welcome. And those who don't come, they will lose this opportunity.
Yeah. Coming to my last question, what's your advice to students who want to set up their own dental practice?
See, most importantly, in any dental practice, the most important element of any dental practice is patient. Not the interior of the clinic, not the equipments, not your skills and not your knowledge. And the first and foremost is your practice needs to be patient centric. How you can make that patient feel better, how you can solve that patient's problem. A lot of clinics I have seen that beautifully designed, very high equipments and very lot of degrees to the doctor and everything, and those clinics doesn't have patients. So that clinic for me is a dead clinic. I need a buzzing clinic where people have trust in that doctor, people have trust in the treatments which are offered by the doctor, and that doctor patient relationship and that entire environment in that clinic is the successful practice. So I would advise all the newly graduate doctors or they have to improve their skill level. That is one thing. But second thing is that they need to focus on giving good and best possible treatments and help people.
Thank you so much, sir, for giving us your valuable time. It's a huge pleasure
Thank
for us
you.
to take your interview.